Let us know when we're good to go. All good. Well, it's wonderful to be here at Sanctuary Cove on the Gold Coast, where the Deadly Maroons are training for that very important decider next Wednesday night at Suncorp with the State of Origin. And I'm here with Deadly Choices in the Queensland Rugby League, who are announcing an extension to their partnership on preventative health and the Deadly Choices preventative health programs. These are really important programs that see thousands of First Nations people getting health checks and getting to be rewarded with these amazing Deadly Maroon shirts as well. But I've just been hearing also that in getting their health checks, they also went into a draw this year to go to that decider at Suncorp next Wednesday night. And there's 18 lucky individuals from remote regional communities right across Queensland who will be flying in to attend that game, many who have never travelled outside of their local communities. So I have no doubt they're going to have an amazing experience, and why wouldn't they when you've got wonderful First Nations people like Selwyn and Cobbo doing their debut in the State of Origin series this year, and so many amazing First Nations greats. We've got quite a few here today, current and former greats. I don't think they're former, they're always greats, and ambassadors for Deadly Choices, including Steve Renoff, who's going to be joining us shortly. And when we talk about preventative health, we do have to look at all of the measures we can be taking to look after ourselves, and that includes dealing with COVID right now. Today, I have 697 COVID patients in our public and private hospitals. We've got another 96 patients with influenza in our hospitals. I have over 2,000 staff that are furloughed just because of COVID, and I've got 7.6% of Queensland health workers off on some form of sick leave right now. So this is putting pressure on our health systems. We know we haven't hit the peak of this wave. The modelling says that we should expect that it will get worse leading up to the end of the month and early August. That means we need to do all the things we know will work. Most importantly, vaccination. I've seen the reports that there may be advice going to the Commonwealth Health Minister from Otago around changes to who can get the fourth booster. But irrespective of any changes on the fourth booster, there are people who are 65 and older, there are First Nations people who are immune compromised, who are eligible to get that fourth booster now. Now less than 50% of those eligible people have come out and got that fourth booster. The information I've been given from our Chief Health Officer is that the latest data shows that if you are over 65 and you have not received your fourth booster, you are 4 more times likely to get the new variants of BA4 and 5. So that's a pretty big incentive to go out and get your booster, and that includes our First Nations people. I also want to put a shout out for those people who are eligible to get their third booster. We've only got 63% of our eligible population who have gone out and got their third booster. We know 2 doses are not enough when it comes to Omicron and the sub-variants of Omicron. We've done such an amazing job of Queenslanders. We are over 94.2% of our eligible population who have had at least one vaccination for COVID. There's no reason why our third dose and our fourth dose should not be at those same levels of over 94%. So please come out and get your vaccination now. It doesn't matter if you have had COVID previously. Whether you had Delta, whether you had Omicron, you can get COVID again, and you certainly can get COVID again with one of these new sub-variants. Just because you didn't become seriously unwell and hospitalised the first time doesn't mean that your body will react the same way when you get COVID again. These vaccinations work. They prevent you from getting seriously ill, certainly reduce that risk of becoming so unwell you end up in ICU, and sadly we are still seeing people dying each week from COVID across this country. So we need to do what we know works. Also, if you're unwell, stay home. It's that simple. If you're staying home, you're not spreading it through your community, you're not spreading it through your workplaces and amongst your friends and family. If you are particularly vulnerable, or you're in settings where you believe that you're at high risk because there's large crowds, then pull out those masks that we all have now and put on one of those masks. If you're on public transport, just as like sitting on a plane in a confined space around lots of people, you should be and you are required to be wearing a mask. So please put those masks on. Good hand hygiene, washing your hands properly. We have sanitisers everywhere now. So please remember, take advantage of those sanitisers when you walk into shopping centres, when you go to businesses, and use those sanitisers. Certainly when you're walking into an aged care facility or a hospital, make sure you are using those sanitisers as well. So these are really simple measures. They've helped us out from day one of COVID, and they continue to prepare us for the oncoming peak of COVID in this current wave. So please take advantage of these measures that we know make a difference. Christy? Well, there is plenty of vaccine available across Queensland. Supply is not an issue. So if ATAGI changes their rules, then I have no doubt community pharmacies and GPs will move very quickly to ensuring that people who are eligible will be able to get that booster. So yeah, there is no reason to delay. Whether you are eligible now or whether there's changes to the eligibility, the vaccines are there. There's different options of vaccines available. Please take advantage of them. Book into your community pharmacy, ring up your GP and get your vaccination. No, we're waiting to hear whether there is any decision. We've heard reports informally that ATAGI may be making recommendations from the Commonwealth, but I haven't seen any formal decisions at this stage. We don't know what those parameters will be and when they would take effect if there is to be changes.
Still definitely no return to a mask mandate at this point?
No, as the Chief Health Officer said yesterday, we know what the risks are. We know masks make a difference. There is still mandatory mask wearing on planes and on public transport, and I remind people of that. But outside of those settings, we ask people to just be aware if they're particularly vulnerable. If they're in settings where there's high volume of people are coughing and sneezing around them, then they may want to wear a mask, and we recommend that for those particularly vulnerable people.
On public transport, we're not seeing that many masks being worn. Is it likely that that'll be more strongly enforced with this next wave coming?
Well, again, it's about personal responsibility. I think we need to be reminding people. There's been a lot of changes in relation to restrictions over the past few months. It is important that we remind people that the mandatory mask wearing is still in place on public transport and on planes.
And speaking of social distancing, that kind of thing, what is the current advice on handshakes?
Look, I know that people have got back into the habit of handshaking. As we come through winter and with the flu and with COVID spreading, certainly people should consider whether they want to keep doing that. But if you are shaking hands, and sometimes that's appropriate in certain settings, then have sanitizer. I've got sanitizer with me at all times. There is plenty of sanitizer around. If you've been shaking hands, then just sanitize your hands or go wash your hands afterwards.
Minister, is there any consideration being given to a pause on elective surgery with the strain on the health system?
So some hospitals are already initiating. I saw an update from Gold Coast University Hospital come in overnight saying they're moving to Tier 3. So this will mean that they will probably suspend some of the lower category planned care. It's at this stage being dealt with at a local level by hospital and health services and individual hospitals based on the number of staff that they have available and also the number of patients that they have. For example, across Metro North Hospital and Health Service, there's 151 COVID patients just in that one hospital and health service region right now. So, and another 22 patients with influenza. So that's obviously going to put pressure on that hospital system, but other areas are seeing lower numbers and might not need to suspend that. So there's no decision to have any statewide suspension. We're allowing the local hospitals to manage that based on their own demands and pressures. I don't have the current, but we can certainly get you some of those figures. What we do know is that especially if you're over 65, you're far more likely to end up in hospital if you haven't had that fourth booster. Any other questions? Thanks, everyone. Don't think Steve.